Welcome back to America's Voice Live. I'm Tudor Dixon here with Matt Locke, and we just got some breaking news that Boris Johnson has been admitted to intensive care. We knew he went to the hospital, and we will have more on his condition later in the program. Right now, we want to get to our guest, Tom Basile. Thank you so much for coming on. We have Tom. He is an author, political commentator, and columnist. Thank you for joining the program today.
Oh, it's great to be with both of you.
It's good to be with you as well. So we have so much going on with coronavirus. We want to talk to you about what is actually going on in the inner circle, where we keep hearing there is light at the end of the tunnel, but also on the flip side, this is going to be the hardest week for Americans. So what should Americans expect to happen this week? What are these models showing us, and what should we be telling the viewers here on America's Voice?
Well, I think the first thing that people need to understand is to have the perspective that there really is nobody alive who has been through the type of situation that we have been through, going through this with coronavirus. And it's been a long time in coming, and that's an important perspective for people to have when they look at what federal and state governments and local health officials have managed to do over these last 8 weeks. That there has been really a whole of America response here, and I give the president a lot of credit for that, despite lazy leftist journalists' efforts to try and diminish what has gone on here. So I think that Americans really do need to have confidence that the military, the CDC, the NIH, the public health officials, and their governors and their public health departments are engaged in trying to safeguard the public. So I think that's the first thing for people to realize. Secondly, it's the death toll is probably going to go up this week, and we have been you hope for the best, but you prepare for the worst, and I think that's what you're hearing out of governors and out of the White House, that we are going to see these numbers start to go up, particularly as the disease looks like it's rolling from the East Coast and rolling into other municipalities and population centers in the Midwest and in the South. So folks need to have more patience, that we're going to be able to get through this. President credit for trying to give people hope and trying to be positive and focusing on the positive. But we need to understand that this is something that is with us, and it's a real threat to human health. What we are seeing in New York is, literally they have tractor trailer trucks that are freezer trucks that have been pulled up outside of hospitals. That is not that's not just happening in one place. That is happening in Manhattan. It's happening in Queens and in Brooklyn, where the morgues cannot keep the number of people. 500 people died from this yesterday alone. So it's it is definitely something that we need to appreciate is very real. And then if I just may want to add one more thing here. It's important for Americans to understand that we have a system of federalism. We oftentimes forget that. We focus a lot on Washington. There are certain things that in a federal system, the federal government takes the lead on, like the military and like defending the country. But our public health departments at the state level have, and our governors have an enormous amount of responsibility here in ensuring that supplies and testing happen, and that the public is safeguarded with support from the federal government. And so for everybody who's out there who says, oh, this is Trump's fault and we need to blame the president anytime something goes wrong, it's not a federal government approach to how we handle this only. It is a joint state and federal and local approach that is unlike anything really that we've ever seen since World War II.
Well, Tom, that was a great little segment there of what you're talking about, because you kind of stole my thunder with a little bit, because we do have these state governors out blaming President Trump for the things that are happening in their state. I mean, there like you said, we are a union of states. The first line of defense is the actual states. So I'm going to shift gears here for a minute, and I want to ask you this question. Why are these models that we're now seeing, why are they so far off And we're starting to see a different narrative out of the president over this weekend as he started taking to social media, talking about the light at the end of the tunnel, talking about having young kids back on the ball field, talking about football coming back in stadiums and in spectators and whatnot. Why are these models so far off?
You know, I think that we always, in our digital media society, we always want to try and answer the questions that we have right away. And I think that sometimes scientists also fall into this trap. But the fact of the matter is that we're still learning about this virus. We are learning about this virus every day. We are learning about the symptoms. We're learning about how it travels. And so as we have this education process going on, we're adjusting the models, and the Washington model, the Washington state model has been wrong repeatedly. But there are other models, like the ones that they're really relying on now at the White House, and you saw Dr. Birx talk about that yesterday during the briefing, that are really far closer and are hitting the mark and are far more realistic, because we're internalizing all of the data that we're getting from the various health agencies through the CDC and the NIH about how this virus actually behaves.
Well, Tudor, I think we might have lost. Do we still? Okay, it looks like we still got everybody. Sorry, it looks like we got locked up there for a second. Sorry, Tom. I'll go ahead and answer the question. Ask another question, because here's what's on my mind going forward. What should the president be telling us? I mean, they've got all the information, like you said. We're learning. We're seeing this. How much longer can we go as an economy and continue down this path without someone saying, you know what? It's time to put people back to work. It's time to make the hard decisions. I'm the guy to do it. You may not like me, but I've got to do this. When do you think that starts happening?
Yeah, I think that toward the end of the month, if we see a flattening of the curve in some of these hot spots, and our scientists are telling us that we're on the opposite side of the hump, then you're going to start seeing the president talk more about some sort of rolling opening, or how do we do this in places where the virus can be is not as much of a concern. And he was talking about that a couple of weeks ago, and clearly they got data that it was just too early to discuss those types of things. So I think that come the beginning of May, you're going to start to see, if it behaves the way that I think that Fauci and Birx think that it's going to continue to behave, that by sometime in May, you're going to start to see an easing of some of these restrictions, because the president is right. We cannot have an economy that is locked up forever. That can do an enormous amount of damage, and that also has a human health and a mental health component for the country as well. So we have to weigh both of those things.
Tom, I want to jump back to state responsibility here, because we do have governors that are attacking him. Governor Whitmer in Michigan is saying that his program did not include states. It excluded some states. It was not well organized to make sure states were prepared. He was giving federal assistance to some states and not to others. But can you explain to our viewers, because that narrative in and of itself affects November. It affects what people think of this president, and it affects this upcoming election. Can you explain to our viewers why states do have responsibility here, and it's not always the federal government should step in and do everything?
Well, look, I mean, it goes back to that concept of federalism, Tudor, because the states do take the lead on public health crises. Your state commissioner of public health, your governors, they are really the front line in terms of a response. The federal government is in a supporting situation. And Governor Whitmer, maybe she's looking to be the number two on the ticket with Joe Biden. Maybe that's one of the reasons why she's been so outspoken against the president. But my question to her would be, where was your stockpile of ventilators and masks? Where was your stockpile of PPE? Andrew Cuomo, the same thing. And the governor in New York is getting a lot of high marks for his response to the crisis. But he had a report on his desk 2 years ago that said that the state of New York had woefully inadequate ICU beds, ventilators, and masks to deal with the pandemic, and nothing was done about that. His own healthcare commission earlier this year recommended cutting aid to hospitals by $400 million. So when we look at the analysis at the end of the day on all of this, it's going to be incumbent upon the states to take responsibility for the fact that they were not prepared to handle this. Now, the Obama administration never replenished the stockpile of N95 masks, for instance, after the 2009 H1N1 outbreak. And there are certainly issues where the president says he inherited a broken system. That is correct. We did not have a sufficient national stockpile. But the states are all supposed to have their own individual stockpiles as well. So I'd be asking her that question. Where was her and her state's stockpile before all of this?
Well, Tom Basile, author, political commentator, columnist, tell people where they can find you. You got about 20 seconds.
Yeah, sure. You can learn more about me at tombasile.com. I have a new book out called Let It Sink In: The Decade of Obama and Trump, and you can find that on Amazon.com. And it's been great to be with you guys. I hope to come back.
Thank you, Tom, so much. Tom Basile, go find him where he just told you to. Tudor coming up on the other side. We're going to go to Ben Berquam. We're going to talk to Ben Berquam. We're going to have a conversation with him. He's out in California. We're going to get a peek into what's going on the West Coast, because not everything is just going on the East Coast. Make sure you go find Tudor Dixon at Tudor Dixon and at Real Matt Locke on Twitter, Facebook, Instagram. Go follow America's Voice News. This is America's Voice Live. Don't go anywhere. We'll be right back.